Hello, everyone. Welcome to our webinar series of staying beautiful and safe during COVID-19. I am here with our amazing physician assistant, Leysin, and I see a lot of you joining right now, so I'm just going to give a little bit of time for everyone to join. We are also streaming live on Facebook for the first time today, so we're excited about that, and you guys will be able to see this on Facebook soon. Oh, I see it's working on Facebook. Yay. So anyways, while you guys are all joining and getting situated, I will just remind you a little bit. At the bottom of your screen, there should be a couple little options. One of them is for Q&A, and one of them is for chat. I encourage you to start now submitting any questions on the Q&A. Leysin is going to be here to answer all of them. And there's also the chat function if you have any questions that you want to direct to me or anyone or everyone. If you're having any problems, we can help get it going. I can help maybe troubleshoot. But anyways, so the people that are on, please, any questions start going in. The questions that would be great for Leysin are anything for sure surrounding CoolSculpting, Thermage, Ulthera, IPL, Clear and Brilliant, and vaginal rejuvenation will be maybe some of the most. Did I miss any topics, Leysin?
Cool tone.
Cool tone. Yes, thank you. So, yeah. Okay, I see some more people joining, but while we are here, so let me again introduce you. This is our CL Derm daily educational webinar to help everyone during the COVID-19 stay home mandate. We hope that it's going to provide you some education and a little resource to help get you through this difficult time that we are all struggling with. Today, we have Leysin. She's our amazing physician assistant. She has been with the practice for how many years now is it?
For 12 years.
12 years. It's amazing. So she has worked side by side with Dr. Goldman and all of our experts for a long time. She's beyond qualified, and I feel like sometimes she doesn't get as much of the limelight because we have so many famous dermatologists, but she really is a phenomenal expert, and I'm excited today for you guys to have her as a resource to ask any questions you might have. So again, go to the Q&A poll and start asking questions. I see a couple coming in already, so it seems you guys are seeing that. All right, so let me get us started. So let's see, here is a new one coming in. So how do I know if CoolSculpting will work for me, and how long will the results last?
Fantastic. Thank you, Risa. I'm excited to be here with everyone. I hope everyone's, first off, staying well and safe at home. And I'm excited to be a part of this question and answer series. Again, I'm a physician assistant, and thank you for joining today. So our first question, how do I know if I'm a candidate for CoolSculpting? Well, actually, if you're within about 15 pounds of your ideal body weight and just have that stubborn pocket of fat that no matter how much you diet or exercise, you just can't get rid of it, you would be the perfect candidate for CoolSculpting. We also like to say, if you can squeeze it, we can freeze it. So, and how long will the results last? That's a great question. The results are long lasting. As long as we can maintain our diet and exercise regimen after we've had the procedure done, the results will last forever. Another nice thing about CoolSculpting is if you actually gain any significant amount of weight over the period following your procedure, it is less inclined to go to the area that we treat.
I'm sorry, I was muted. Okay, another question has come in. So okay. I have some friends who have gotten CoolSculpting, but they haven't seen much of the results. Does it not work for everyone?
So the way we approach CoolSculpting has changed over the years. I've been doing CoolSculpting since the beginning and been involved in some of the pivotal trials that we've done for Allergan. The latest technology, which is the Cool Advantage technology, is the most current technology, and we're really focusing on the Treat to Complete campaign, which what we like to do during our consultations with our patients, we customize a treatment plan with one area as a primary focus is where we like to start. Too often in the past, patients were being treated all over their body with a single treatment. Say they were having their abdomen, their flanks, their chin, and their thighs all done one time, and then they would come back 8 to 12 weeks later and be underwhelmed with the results and wonder why it didn't work. The way CoolSculpting works is it's a journey. So it's a non-invasive procedure. So that's why we like to say, as long as you're within 10 to 15 pounds of your ideal body weight in the area that you want to treat, you're going to be the most responsive to the CoolSculpting procedure. So I would start with your number one area of concern. We'd perform the procedure. We would have you follow up in the clinic 6 weeks later. We would assess the tissue and assess the results through our before and after photos. We do have a professional photographer in our practice, which is great, so we can get nice photos to track your progress. And at that time, we would consider the next treatment. I do like to emphasize, because CoolSculpting is a journey, you want to count on needing to treat each particular area of concern, 2 to 3 times to get the ideal result that you're looking for. I have seen wonderful results with my patients. I'm a master CoolSculptor. I was fortunate enough to attend the Master's CoolSculpting University up in Pleasanton at the Allergan headquarters, where we actually learn to treat the most complex of cases. So I feel very comfortable and confident that I can customize the treatment plans to each of you individually to give you the results you're looking for.
Okay, fabulous. Okay, lots of great questions coming in, guys. Please keep them coming. For now, I'm going to try and stick to the ones on CoolSculpting since we're on that topic. Let's see. I've heard it can take multiple hours to sit at the practice, and I don't have time for that. Are there any other options?
So at our practice at Cosmetic Laser Dermatology, we are fortunate to have 2 machines. So we're able to treat an area in half the time that you would otherwise have to do if you were to be at a practice with only one single machine. And because we would focus on one area, let's say you chose your flanks to treat for the first time, we could do that in as soon as 35 minutes, which would be a lunchtime procedure, so that you'd be able to return to work right after treatment.
Beautiful. Okay, let's see. There's some coming in about cool tones, so that's a good segue. So I guess tell us, what is cool tone? I've been hearing about it lately, and then someone else says, how long do the cool tone results last?
So CoolTone is by Allergan, by CoolSculpting. It is our latest device. It's probably our newest device that we have in the practice. It is a muscle magnetic stimulation device. This particular device stimulates your muscles to contract involuntarily for a 30-minute period of time. We can treat the abdomen, the buttock, and the thighs with this device in just 30 minutes. It is recommended that you come in twice a week for the 30 minutes for 2 weeks. So you would do a total of 4 treatments. It would be the equivalent of doing 20,000 sit-ups or squats in that 30-minute period of time. So you are exercising those muscles for that 30-minute period of time for twice a week for 2 weeks. This builds strength and tone. If you're an athlete, you're going to feel stronger in your sport that you're performing. If you're looking to just jumpstart a diet or exercise plan, this is a great way to start. In fact, we're actually combining it with CoolSculpting, which is to optimize the results of the treatment, which is very exciting. So we're able to get rid of the excess adipose tissue or subcutaneous tissue with the CoolSculpting, followed by building strength and tone with the CoolTone device. So this is really exciting.
Very cool. Okay. Let's see, here's a cool anything question. Are there any benefits for derma rolling in collagen synthesis? And is there any difference between if it's done at home or in the clinic?
So derma rolling, as far as referring to the at-home devices that you purchase at, say, Ulta, is that what we're referring to?
Okay, Aaliyah, can you clarify a little bit more with your question, please, so we can come back to that. Okay, while we're waiting on that, let's see. Can a person with Fitzpatrick 4 skin type do an IPL?
It is not recommended to do IPL on the Fitzpatrick 4 skin types. The intense pulse light is attracted to pigment, and in a Fitzpatrick type skin type 4, you are at a very strong risk of getting burned and hypopigmented. So that is not our treatment of choice. However, we do have lots of other treatment options for Fitzpatrick skin type 4s in our practice. We've got over 50 lasers and devices. So it would be best to see what your primary concern is and then come up with the best plan for your skin type.
Okay, great. Here's one from Mary. So for maintenance after laser resurfacing, would you suggest IPL or Clear and Brilliant Premia? I have red head complexion with some freckling slowly coming back. I'm also out in the sun 5 days a week from 9 to 11. I understand that IPL is not as effective as laser.
If you've had the laser resurfacing, a great way to maintain the results would be with the intense pulse light. We consider the intense pulse light treatment at our practice like a dental hygiene procedure, where we recommend having that every 6 months to maintain the health and quality of your skin. So I would think the intense pulse light would be a great option for you. Great question.
Okay, perfect. All right. Suzette says, what is the difference between IPL and Clear and Brilliant?
So the IPL is an intense pulse light which targets pigment and redness, broken capillaries. So it will improve the texture of the skin, the sun damage, the broken capillaries, any generalized redness in the skin. The Clear and Brilliant is great for patients that have pigment disorders or such as melasma. We like to use the Clear and Brilliant Premia for melasma. And we also like to use the original handpiece for the Clear and Brilliant for texture changes and for tightening of the pores. We're not afraid to combine the two, to be honest. We love to do IPL and Clear and Brilliant, the original Clear and Brilliant, to optimize the results for patients. We do recommend doing these treatments once a month, really about 4 or 5 times, and then maintaining those results about every 6 months with a single treatment thereafter again. But I love both the IPL and the Clear and Brilliant.
Okay, great.
Mm-hmm.
All right, Aaliyah, I hope I'm pronouncing your name right. She's the one that asked about the derma rolling. So she's clarified a little bit more. She said, I'm asking about the derma rolling of 3 millimeters for the face.
Okay. So the at-home devices that you can get are great to use in times like this when we don't have other options. If you're looking to actually stimulate and promote collagen growth and optimize collagen growth, we've got devices in our practice such as the Thermage FLX and the Ulthera, which both devices stimulate collagen production. While we're on that topic, a little difference between the two. The Thermage, in our practice, we've got the FLX. I believe we're one of 2 places in San Diego that currently have the latest Thermage FLX device. This particular device uses radio frequency or a form of heat to deliver about 4.3 millimeters down to the layers of the collagen to stimulate and contract collagen growth to tighten the skin in time. This particular treatment is a one-time treatment done in the office. It takes about an hour to an hour and a half to do under no medication. We do use our laughing gas or Pronox to have our patients more comfortable during the treatment. And we kind of gauge your feedback as far as the heat is concerned. We want you to feel that heat, but we want it to be tolerable heat. Over the course of 6 months, as our body is producing new collagen, our skin begins to tighten. This treatment is great to do if you've got an event coming up that you're looking to get some instant tightening, because right after treatment, you'll have 1 week where your skin will be instantly tighter. And then as the skin regresses over that week's time, your body is producing new collagen growth over 6 months. So the full effect is 6 months out. The Thermage FLX is meant to be performed once a year to maintain that collagen growth and to keep the skin tight. Ultherapy, which is another wonderful procedure, uses ultrasound technology to stimulate collagen growth. We're able to kind of go different depths in the tissue to stimulate and maximize collagen growth at different layers of the skin's tissue, which is great because we're able to maximize the amount of collagen growth. Either procedure is wonderful. I highly recommend both. I actually have had both of them done, and I've been performing both of them for 10 years.
Okay, great. So let's see. Can you use CoolSculpting on your chin or neck?
Yes, on the chin, in the submental area, right under here is a great area, and then right along the jawline. We would just want to assess the area to make sure that there is subcutaneous tissue there in order to squeeze and to get into the applicator. If it is just skin, then we would not want to do CoolSculpting in that area. We might want to look into a different modality for skin tightening, such as the Ultherapy or the thermage. But yes, you can actually really contour along the jawline and the submental area with CoolSculpting. We've got different sized applicators. So for that area, we use a real small applicator just so that we're treating that little area of subcutaneous tissue there. With the small applicator that we use there, the clinical studies have shown that it's best to do 2 treatments about a month apart in that area. So again, you'd want to kind of focus on needing to do it more than once to get optimal results.
Okay, great. All right, I want to take a quick break from the Q&A and run a little poll now that a lot more of you have joined. So there should be a little poll that has come up on everyone's screen. And if you guys could just answer real fast, just to help Leysin know who she's speaking with and to help us, you know, understand how we're doing with this whole webinar series. You will also receive a little survey after the webinar is complete, asking you for some feedback and, you know, any information or you're comfortable sharing, we would love to hear. Of course, this is new for us. This is new for you guys. So we want to be making these as useful as possible for you. So I hope that gives you a good place for feedback. All right, I see a lot of you are still answering. We'll give it another 15 seconds. Okay, don't forget at the end, you have to press submit for your answers to go in. All right, press submit. Last chance. Okay. So let me share these results and hopefully Leysin should be able to see those as well. Leysin, can you see those?
Yes. Yep.
Okay, great. So it seems about half of you have been patients. Most of you have never been to any of our events. You guys heard about this on email and Instagram. And a lot of you in San Diego, a couple in California, and we have 2 international people tuned in. So that's lovely. And then what cosmetic laser procedures have you had before? So it seems about half of you have had some esthetician procedures and Botox. And then, you know, less than 30% have had anything kind of beyond that. So this is, you know, a lot of you would be new to these types of treatments. So I think this is great and you're probably coming to learn. So please keep the questions coming. All right. I'm going to come back here to the questions. All right. So, oh, this is a great question, Mary. I love this one. You just popped it up. Is the IPL machine you use the same one that they use in a medical spa?
The answer to that is no. At our practice, we use the luminous IPLs, and Dr. Goldman actually developed the first luminous IPL in his garage years ago. So the luminous IPLs are much better as far as more powerful. They'll give you better results. Oftentimes at medical spas, in order to get the results that you would get at our practice, you would have to do a procedure 5 to 10 times versus needing to do it 2 to 3 times at our practice. I love the luminous IPLs. We've got the M22 IPL, and we're doing clinical studies on an even newer IPL called the Stellar IPL. So we're very excited, and hopefully we'll be able to be offering that to you very soon.
Fabulous. Okay. All right. Suzette says, what is the downtime for Clear and Brilliant treatment?
Great question. The Clear and Brilliant treatment has no downtime. So right after treatment, you might be slightly pink. By the time you get to your car, most of that pinkness will be gone. In fact, we actually have some nice skincare products that we put on right after treatment to even take away some of that immediate pinkness. The second day after treatment, the skin might be rough, but you can't really see rough. You can feel rough. So we consider it a procedure of no downtime. You won't be peeling or flaking. It's something that can be incorporated into your daily life, even again on a lunch break, and you can put makeup on immediately after treatment. One thing I really love about the Clear and Brilliant procedure is that it opens up all of your channels. It's a perfect opportunity to be using all of your medical grade skincare products, because those products will penetrate even deeper immediately after the Clear and Brilliant procedure. So we love to put on our favorite products, our growth factors, our serums, our vitamin C, ferulic from SkinCeuticals right after treatment. And of course, as long as you're protecting the skin with a great sunscreen, we love the Isden sunscreen. It's an SPF of 50. It does come available now in a tint, which is fantastic. So a lot of our patients, that's flying off the shelf as we speak. I love the Clear and Brilliant for that reason, because it opens up all those micro channels and allows all the skincare to get in very, very, very well.
Yeah, absolutely. So I think some people, or Carmen, can you clarify your question? Are you asking for the practice range or maybe the price range? If you could clarify. Okay, so here's another question. What % improvement is typical after one treatment with Thermage FLX?
So percentage, I would say 25 to 30% would be roughly what I would be able to say. Depending on the area that we treat, the Thermage, we can treat the face, the neck, the eyes. We actually have an eye tip where we can treat up inside the orbital rim of the eyes, all the way down to the lash line on the upper lid and all the way up to the lower lashes on the lower lid. So we can get some nice tightening in that area. And then of course the body. I have some patients that treat their entire body with it because they've been so happy with the results for the tightening effect. But I would say roughly 25 to 30%. And then if you repeat the treatment again, say 3 to 6 months out, you're going to get additional benefit in addition to that 25 to 30%.
Okay, perfect. All right, so here's one from someone anonymous. After having a Clear and Brilliant treatment, I had patches of raw skin on my cheeks. Do you have any idea why that may have happened?
I'm not sure why that would happen. I guess there's a possibility. It could, depending on what your skincare regimen is, I would have to ask some additional questions. I would be curious to know what medications you're currently taking when this happened, as well as what topicals you were using prior to the treatment. If you were using a harsh Retin-A, if you'd been on Accutane, any photosensitizing medication that could potentially cause extra sensitivity to the skin, those could all be a possibility. But really the Clear and Brilliant is an ultra safe procedure that can be, we kind of consider that our procedure with training wheels. So somebody who's very new to the cosmetic industry that is looking to do something just to kind of turn back the clock and brighten up the skin and improve the texture of the skin, I would definitely direct somebody to the Clear and Brilliant because it's a very safe, simple, no downtime procedure. So those would be the questions I would ask to be able to answer that question.
Okay. So if you want to type those back in now, and if not, since that was a little more like personal information, Leysin is available for one-on-one virtual consultations, just as all of our practitioners are. You can go to our website, our contact page, and get yourself on her schedule. It's available now to book. Okay, so let's see. Sandra says, what are the best treatments for cellulite apart from Selfina?
That is a tricky question. I would refer you to our research department because we do have some clinical trials going on for cellulite. I think that would be a great place to start. Other than the sulfina, that also could be a good question to ask one of our board certified dermatologists, because I know some of them are doing some off-label treatments that have been beneficial for cellulite. So I would redirect your question to a board certified dermatologist at our practice.
Okay.
And also possibly look into our research studies, because we are doing a lot of research with cellulite right now.
Yeah, that's a really great point. I'm glad you bring that up. For any of you that are not aware, we have a full research division of the practice. It's on our website, clderm.com/research. And you can see the trials that we're currently enrolling for. If you are eligible, you can receive free treatment and often even additional compensation on top of that. And this is, one of the ways to be able to utilize some of the technology that's not even available yet. But, because of who our doctors are and who our practice is, we are testing and, perfecting the protocols for them before they get released for everyone. So it's definitely a good option. Okay, so there's a lot of questions coming in about pricing. I know it's difficult and it really depends on the unique person, but I don't know if you're comfortable giving any sort of price range or maybe some sort of range of like the procedures that you're talking about, which ones are on the lower end and which ones are on the higher end to give people some idea.
Sure. Yeah,
okay.
which procedures?
So they're, all of them. Someone's asked about thermage, someone about for the, let's see, she asked for the under chin jowl tightening. Some people are just saying in general, all of them.
Yeah. So, we always offer monthly promotions and different things. So throughout the year, we'll have different promotions on different procedures. For the thermage procedure, it basically depends on the area that we're treating and the number of tips that we're going to be utilizing in order to provide a good estimate. So it's hard to kind of give you a quote without knowing more detail as far as what areas you're interested in having done. Our CoolSculpting prices have recently lowered. So we're down now $150 off of our normal pricing. So we're down to $6.50 a cup. So again, but it does depend on an assessment and a personalized, customized treatment plan in order to provide pricing. We also offer care credit and Alphion and some different treatment payment plans that we can set up and assist with too, which is great. So we can make some of these numbers that seem like they're a little bit high, we can really lower it into a very small monthly payment to make it very feasible for anyone. So we're able to kind of work with everyone with any of our pricing and any of our procedures that we offer. Our IPLs and Clear and Brilliance, again, it just depends on how large of an area we're treating. As far as the pricing is concerned, but I hope that answers the question.
Yeah, I think that's great.
Yeah.
And normally for in-office consultations, we offer complimentary consultations with Leysin and a number of our physicians. So there's definitely no risk of coming in and having a full assessment. So someone like Leysin could really help come up with the exact treatment regimen for you and a specific quote of the price. So, we're not trying to hide it. It really is so specialized for every person. And there is not, just one treatment regimen that we offer for everyone. It's going to be something different depending on your skin type, your needs, your age, and so many issues. Okay, so here's someone that sounds like they have a wedding coming up. How many weeks out before an event would you recommend Clear and Brilliant for optimal results to be seen? And overall, what are your favorite treatments to prep before a wedding?
Congratulations, that's exciting. I do recommend kind of starting as early as possible before a wedding. So if you can start 6 to 8, even a year before, that would be ideal, because then we can actually come up with a treatment plan and really incorporate a lot of our awesome procedures to get you ready, including laser hair removal and of course IPL and Clear and Brilliant. You could actually do an IPL and Clear and Brilliant, I would say 2 to 3 weeks before your wedding, and be very safe to say that you're going to be photo ready for your wedding. But you're going to want to plan to do it a few times. So that's why I say if you can allow 6 to 8 months before your wedding, that would be ideal, just so that you're not waiting to the last minute. We can optimize the results if we have more time.
Perfect. Okay. So Suzette says, which laser gets rid of red spots on my face, and which one will shrink larger pores?
So the V-beam is a fantastic laser. It's a pulse dye laser that targets redness and broken capillaries. So depending on our consultation and your skin, I would either go straight to the pulse dye laser, the V-beam, or I would recommend the IPL. So the IPL can help with pores and also redness. The V-beam can target just redness. You might see some improvement in the pores, but it's more just redness and broken capillaries. So a combination of a couple lasers.
Perfect. Okay, so let's see. What are the areas that can be treated with CoolSculpting?
Great question. So we can treat any area that has a stubborn pocket of fat. So the common areas that we treat, the chin, the arms, the abdomen, the bra fat, the banana roll, the inner thighs, the outer thighs, really any area that you have that stubborn pocket of fat. Even the knees we've treated. The arms are a wonderful area, especially with, you know, the summer months coming up and wearing more sleeveless tops and dresses. The arms we're able to treat all the way from the axillary area all the way to the elbow, and they happen to be a hyper responsive area with CoolSculpting. So typically one treatment, again, I don't like to promise just one, but one treatment really does a lot for the arms. So that's kind of a fun area to do coming up into the summer in the warmer weather. But yeah, we can really treat a lot of different areas. We've got multiple applicators. We've got all the different applicators, different shapes, different sizes. And again, the latest technology, the Cool Advantage. So we basically, based on our customized treatment plan, we come up with a good plan and the applicator that we're going to use to give you your best results. Yeah, and then we actually also at our practice have the Zimmer Z-Wave, which is a radial pulse technology device that we use in conjunction with our CoolSculpting treatment. So after we remove the applicator, we use this device for a 2-minute massage to really break those fat cells up and give you extra result as opposed to just a manual massage. So that does kind of set our practice apart from other practices, that we do have the Zimmer Z-Wave, which is wonderful. And then again, now with this Cool Tone, I'm very excited about that, combining the CoolSculpting and the Cool Tone.
Perfect. Okay, Carmen asked, are you open these days for a consultation? So I can help answer that. So right now our office is closed except for essential visits, and unfortunately they don't feel that these are essential visits. However, we hope to be open back soon. Right now we're actually hoping to open up on May 4th, I believe is the latest. So we're trying to be optimistic. Of course, you know, we will follow whatever the law says and for the safety and well-being of our patients and our staff. But as of now, that's our optimistic outlook. However, we are available today, any day you would like, for a virtual consultation. And there's still so much that we can do virtually. You can send photos ahead of time. We can still do a full one-on-one assessment. You know, and then when we do open back up for treatments, you already know what you want and you can get yourself scheduled and planned in. So that answers that question. All right. Okay, let's see. What do you recommend instead of IPL for patients with ethnic skin?
So we have a couple different lasers that I would recommend. So again, the Clear and Brilliant, and then also the Pico Way, which is a picosecond technology, is great for skin, for ethnic skin. If we're addressing photo damage, so some age spots or brown discoloration, again, those two devices are great options: the Pico Way and the Clear and Brilliant Permea, or Clear and Brilliant.
Okay, perfect. All right, let's see. Suzette again says, how long does a CoolSculpting treatment take?
So it depends on the area that we treat. If we're looking to treat the abdomen, oftentimes anywhere from 4 to 6 applicators would be necessary in order to treat the abdomen. Oftentimes, if the areas are spread far enough apart, we're able to treat 2 at once. However, so if we were to do 6 applications on the abdomen, it would probably take about an hour and a half to do. If we were to do 4, it would still take an hour and a half to do, because I would want to treat them separately. I definitely do not want to compromise my pull or the suction of the subcutaneous tissue into the cup by overlapping or trying to get 2 applicators on there for sake of time. We always want to try to give the best result. And so that's how we would do that. Now for the flanks, let's just say for the flanks, oftentimes I will do, are the love handles. The flanks are the love handles. If I were to treat in 2 different areas, like the front and back of the flanks, it could be 70 minutes. If you just need 1 on each flank, it could be 35 minutes, because we have 2 machines and the treatment cycles are typically 35 minutes for the Cool Advantage applicators. Now, let's say the arms, for instance. If I want to treat all the way down from the axillary area to the elbow, and I'm going to put 2 applicators on each arm, again, it's only 70 minutes. So it's very, very quick and very easy to incorporate into your day.
Fabulous. Okay, here's another one. So what treatment would you recommend to control acne on a 50-year-old?
So we have a procedure called photodynamic therapy, or PDT. That is a great procedure to actually control the overactive oil glands and actually get to the root of the problem, or the bacteria that's building up in the oil glands that leads to those breakouts. Photodynamic therapy is a procedure where we do it in the office. You come in, we exfoliate the skin, we apply the medication. It's a topical medication that has the ability to be absorbed into the oil glands and basically shrink the oil glands and destroy the bacteria in those oil glands. And then in our office, we've got various lasers that we use to activate that medication after you sit for a period of time. We utilize the intense pulse light, or the IPL, that we've spoken about, which will address any redness and any brown and help with pores. We use the V-beam, or the pulse dye laser, to actually, again, help with redness. And then we use a red and blue light, which is it's a series of 4 different lights and lasers to optimize the result. That particular treatment, you're going to want to plan for some downtime, though, because that light that that medication that we apply to the skin can be reactivated for about 48 hours by even ambient light. So you'll want to plan to do that at the end of the day and plan to be indoors for about 48 hours after the treatment. Maybe a good time to watch movies or reorganize a closet. And then you're going to peel for about 3 to 5 days afterwards. I will tell you that the results of that would be my best recommendation. But again, it does depend on the severity of the acne. So a little more history would be helpful if you're on medications, if there's any hair in the area, because sometimes even just hair in the area can be the culprit that's causing the breakout. So if you're breaking out and you've got some dark hair there in that area, we've even seen improvement in acne just with doing laser hair removal to get rid of the hair in the area along that jawline or the upper neck area. So I would ask a few additional questions, but I hope that helps. I love the PDT, the photodynamic therapy. It's a great treatment. Typically, it may need to be repeated. So we do it once. You may need to repeat it depending on the severity of the acne. And then again, maybe maintaining it every few years afterwards. So
Great. Okay, you
yeah.
brought up something important that I forgot to mention earlier, and that laser hair removal is definitely another big area of Leysin's expertise. Maybe you could speak real briefly about who's a good candidate for that. I know some questions came up yesterday in the webinar, and maybe also if anyone was in the middle of a series of treatments
Yeah.
with laser hair removal or any of these
Yeah.
procedures, because this is obviously a
Absolutely.
concern right now.
So laser hair removal, we're fortunate to have 4 of the best lasers in the country to do laser hair removal. An ideal candidate is someone with light skin and dark hair. So the laser loves that contrast. However, in our practice, we're able to treat all skin types safely and effectively. So if you, from very, very light skin to very, very dark skin, we have the technology to treat. The big key factor is if the hair is dark. As long as that hair is dark brown or dark black or has some pigment in the hair color, the laser is able to see it to treat it. We are currently working to get a solution on those light hairs. So if you happen to have blonde hair in the underarm, we've got a clinical study we're enrolling for. But as of now, there aren't any lasers that are currently on the market to get rid of white, blonde, gray, or strawberry blonde hair. We're able to remove dark hair anywhere, so head to toe. The treatments basically are based on the interval of the growth phase of the hair. So we want to catch those hairs in the active growth phase or the anagen phase of the growth cycle. So depending on the area that we're treating, we would let you know the interval that's best to treat. Typically underarms and bikini, it's about every 4 to 6 weeks. You're looking at about a 15% reduction with each treatment. So basically around 4 to 6 treatments of any area to be about 80% reduced. And then after that, once a year to maintain those results. Facial hair, you might need or you will need to maintain about every 3 to 4 months, just because of the hormone-driven aspect of facial hair growth. Now, as far as the series, to answer that question, yes, I'm sure we have a lot of patients out there right now wondering, oh my gosh, I started my series of laser hair removal and now I'm not able to go in for a period of time. And actually, to be perfectly honest, it might actually be a really good thing to go a little bit longer, especially patients that are have had a few treatments. It's good to allow whatever hair remains to come back in, and then that way we can target that remaining hair. And for those of you that have just started, those hair follicles that have been damaged with the treatment, because that's what the laser does, is it damages the hair follicle, are permanently damaged. They're not coming back. So then you may ask, well, why do I have to do treatments every year? Because we will ongoing throughout our life grow new hair follicles. So if you've started your laser hair removal, those follicles that have been damaged are damaged. You might be growing some new hairs along the way, but rest assured, a little bit longer time frame between treatments is perfectly okay. And you know what? That goes for anything else. Same for the IPL or the Clear and Brilliant treatment. If you go a little bit longer, it might be even better. So it's going to allow time for IPL to maybe give you a little collagen growth to kind of help get rid of the byproducts that the IPL have actually created for you to eliminate them naturally. And you might get better results even having to go a little bit longer. So not to worry.
Okay, perfect. So a couple more questions have started coming in about laser hair removal now. So is the upper part of the arm is a stimulation zone? I think they're probably asking, can you treat hair on the upper part of the arm?
Yes. So the thing we would want to make sure is that the hair is thick enough and coarse enough for the laser to be able to pick it up. So the laser's not able to pick up baby fine hair, but as long as it's dark and has enough density to the hair, we should be able to pick it up. So, yep.
Perfect. Okay, and she says the hair in this part is black but thin. So would laser will be an option?
So yes, as long as the hair is dark, we should be able to get rid of the majority of it.
Okay, perfect. And let's see, when doing a combination of treatments, how long should we wait in between sessions, or do you do them all at the same time?
So it really just depends on your time. So if you have the time to come in and do multiple areas all at once, I would just you might have to go a little bit longer in certain areas to accommodate the growth cycle in another area. So let's say you're doing the legs. The legs are every 6 to 8 weeks would be the interval that we would treat. If you've got your bikini and underarms in there that are every 4 to 6 weeks, we would certainly want to wait 6 weeks so that we're not treating the same growth phase for the bikini and underarms if you were to come in sooner than the 6 weeks, if that makes sense.
Perfect.
Yeah.
All right. Let's see. There are still more questions coming in. Feel free to keep them coming. We do have time for a little bit more, guys. So, are there any treatments to help stop and recover hair loss from menopause or thyroid issues?
So yes, we actually have, we offer platelet-rich plasma or PRP at our practice, which is a great treatment option to kind of help with hair loss. However, what I recommend with my patients is to be seen on our general dermatology, West dermatology side of our practice to first get the appropriate blood work and have an evaluation by our dermatologist to make sure there's not an underlying health condition, like in your case with the thyroid condition. We want to make sure we're able to correct that physiologically first, and then once the labs have all been reviewed and addressed, then we could consider doing platelet-rich plasma, which is a procedure that we inject your plasma into the area of hair loss, into the scalp, and we're able to stimulate some new hair growth in that area. The treatments are typically done once a month for 3 months, maybe even 4 months, and then we maintain the results about every 6 to 8 months to continue to see the benefit.
Okay, beautiful. All right. Let's see. Oh, here's a great one. I am 42-year-old mom of 3, and I'm curious if there's any treatments available yet to help with a leaky bladder.
Very good question. And yes, we actually offer 2 different procedures for vaginal rejuvenation at our practice. One of them being Thermiva and the other being Vivive. Both procedures are very, very easy. They take 30 minutes to do in the office. Both of them utilize radio frequency or heat as the form of energy. For leaky, Thermiva basically we can actually treat internal and external. So we're able to tighten the skin to aesthetically improve the appearance of the labia majora. And then we're actually able to stimulate blood flow to help with lubrication and for stabilizing the bladder wall, which is what's responsible for the leaky bladder. With Thermiva, the treatment's done once a month for 3 months, and then we maintain the results about every 8 months with that particular procedure. Now, if a patient has just strictly a bladder incontinence issues, the Vivive is an excellent way to go. So it's a single treatment. You do 1 treatment. It takes about 30 to 45 minutes. And then that procedure is repeated maybe once a year. But that is only addressing incontinence issues. It's not helping with aesthetic appearance. It's not helping with any improving arousal and some of those other issues. So again, we would customize the treatment plan to each individual, and both procedures are simple, they're painless, no downtime with either procedure. And I've got a lot of happy patients that repeat this treatment every 6 months.
Great. So there haven't been a lot of other questions coming in about vaginal rejuvenation, but I feel like a lot of people maybe just don't want to ask. So what else can you tell us, since this is totally confidential and no one, we can't see anyone's face. So tell us a little bit more about the treatment and, some of the questions that you commonly get or.
Yeah. So with Thermiva, some patients want to know if it's painful and, what they can expect during treatment. And at our practice, we have We basically have a nice room that has the stirrups available. The wand is smaller than a tampon, so it's very, very small, so it's not painful. You're gonna feel heating pad-like sensation warmth. It takes about 15 minutes in the vaginal canal and 15 minutes on the labia majora and labia minora. It's a very comfortable procedure, and you're safe to resume your normal activity that evening. Other improvements that you're gonna see, so again, it's gonna help if you have issues with painful intercourse, with dryness. It is a good adjunct to therapy for patients that are on hormone replacement therapy. You can continue to do Thermiva with the hormone replacement therapy. If you have an IUD, it's safe to have the Thermiva with an IUD in place. A lot of patients like to know that. We do like to have a normal pap smear on file within 3 years. So we do ask our patients to bring that in with them the day of treatment. We ask our patients to have a clean shave from the night before so that there's no irritation prior to treatment. And that is the Thermiva, and you do it once a month for 3 months. And how soon will you notice improvement? I would say you'll notice improvement even that night would be first reported improvement. I've had patients that have reported that their arousal is improved, and even that night. As far as improvement in incontinence, it takes about a month for the incontinence to improve. I like to stress that it's mild to moderate incontinence that is the most improved. If it's severe, it's probably beyond what we would be able to do with Thermiva or Viviv. We do want to make sure that there's no prolapse present. If you have prolapse, which is basically dropping of any of the organs, this procedure is probably not the right procedure for you. So anything with mild to moderate symptoms would be the most beneficial, or best candidate for these procedures. Now, Viviv, the beauty of Viviv is it is a single treatment. So you come in one time, 30 to 45 minutes, and then you just come in once a year. It takes about a month, just like I said with Thermiva, to notice the improvement in the incontinence. But again, the best candidate for the incontinence for the treatment of Viviv is mild to moderate. With Viviv, we're not treating externally, so you're not going to see any aesthetic skin tightening in the labia majora minora. This is a strictly internal treatment where we're stabilizing the bladder wall, and we'll be able to help with dryness and help with lubrication in that area. So both treatments are great, and again, it's just best to customize the treatment plan based on your specific needs. And really, who's a candidate? Any age. You know, I've had patients as young as in their 20s, all the way up into patients into their 70s and 80s do the treatment.
Okay, fabulous.
So, yeah.
All right, so we only have a few minutes left, so any final questions, please submit them now. For now, here's a good one. For a 40-something, if you could do only one treatment, what would you recommend for skin tightening and skin texture improvements?
So the Fraxel laser would be what I would recommend. It's the Fraxel Dual. It's a non-ablative laser resurfacing procedure that we're able to stimulate collagen growth and address texture and pigment. That particular treatment, we're able to customize the treatment to our patients' downtime. So if you have the ability to have some downtimes, we're able to adjust our settings to give you a little bit better treatment with a single treatment. But again, if somebody is looking for a little bit less downtime and not afraid to do it again in a month, we can do that as well. That's the beauty of the Fraxel laser. That particular treatment, you'll want to plan, you know, anywhere from 24 hours of kind of redness and swelling, and then a little bit of sloughing of the skin. But overall, I think that would address photo damage and skin laxity concerns. I think that would be an excellent option.
Okay, perfect. Okay, so we kind of addressed this one a little bit already, but maybe the person just logged in late and it's still a good question. So I see a lot of places advertising CoolSculpting and some are less expensive. What is different and better about how you do it?
So at our practice, I'm a physician assistant, so a mid-level practitioner. Only physician assistants and doctors perform the procedures at our practice. We do the marking and the application of the applicators. I personally attended the Master's CoolSculpting course through Allergan up in their headquarters in Pleasanton. So I am advanced in the training, and we've done a lot of the clinical trials at our practice to help them get approval for different areas with the CoolSculpting device. So you're coming to a very experienced practice to have the procedure done.
Okay, perfect. All right, and let's do this one as the last question. So I'm 25 years old and I'm new to the cosmetic world. I'd like to know where to begin to stop the aging process.
So my favorite procedure for someone that's new to the cosmetic world is the Clear and Brilliant treatment. It's a laser that will actually help address texture changes. It can help with some mild pigment changes and overall just brighten the skin and kind of turn back the clock a little bit. So the Clear and Brilliant procedure in conjunction with good skincare. So I'm a big advocate of medical grade skincare. I think you'd be doing much better than 99.9% of the population. You're never too young, or it's never too early to start, because if we can start young, then we're going to be able to avoid the larger procedures or the bigger procedures for a longer time.
Perfect. All right. Well, to wrap this up, thank you everyone who tuned in to get some Q&A with our physician assistant and master CoolSculpting expert, Leysin. If there's anything else we can do to help, please feel free to go to our website, on our contact page. There's a place where you can submit a message, or you could set up your own one-on-one consultation. Otherwise, we have tomorrow a body sculpting webinar coming up at the same time at noon Pacific Standard Time with Dr. Kimberly Butterwick. So she'll be speaking a lot about liposuction and, CoolSculpting again, and all the different modalities to contour and sculpt the body. And then on Thursday, we have an open QA with Dr. Bowen. And on Friday, we have lunchtime lasers with Dr. Wu, where he's going to discuss a lot more about IPL and Clear and Brilliant and show a lot of before and afters. And then Leysin herself will be back the following week for a more formal presentation on vaginal rejuvenation. So thank you so much for tuning in. The recording will be available on YouTube and on Facebook. It's been streaming live on Facebook as well. And tomorrow you'll receive a survey, and we'd love your feedback, anything to help us improve. And otherwise, we wish everyone a great rest of your Tuesday.
Thank you, everyone. Bye.
Bye.